Welcome to our education session on infusion therapy. Something important to know about infusion therapy is that we care for people with a variety of health issues. You will see a lot of other patients in the clinic while you are receiving your treatment. While the majority of our patients in the clinic do have a cancer diagnosis, people are also being treated for anemia, rheumatoid arthritis, iron deficiency, dehydration, and many other health problems. What all these people have in common is that they need medicine that isn't given as a pill or a liquid. They need it as an infusion. Infusions are a way to deliver medications directly into the bloodstream. The term for this is intravenous, or as it is commonly called, through an IV. If you have an appointment at infusion therapy, it means at least one of your anti-cancer medications is being given intravenously. There are three different ways to access a person's veins: a peripheral IV, a PIC, or a port. Your Enloe Health team will make a plan on which route is best for you. The most simple method is a peripheral IV. An infusion nurse will insert and then remove the peripheral IV on the same day. A peripheral IV is used for short-term treatment and if medications are not too harsh on the veins. We use peripheral IVs for people whose veins are in good condition. Please make sure that you are well hydrated when you come in, as that will make it easier to find a good vein. Another vascular access device we frequently use is called a PIC, which stands for Peripherally Inserted Central Catheter. It's like a very long IV that is placed in your upper arm, and the tip of the long catheter is in a very large vein in the middle of your chest. A PIC is inserted by a vascular access device or VAD nurse over at the main hospital. It's a sterile procedure and does not require any anesthesia. A PIC line can stay in for several months, so it's a good choice if treatment is going to be completed within a couple of months. Something important to know about PIC lines is that they need a sterile dressing change done every week. So even on the weeks that you do not have an infusion, you will need to come in for the nurse to assess the PIC line and change the dressing. There is so much blood flow through the vein the PIC line is in that any harsh medications are quickly diluted and don't hurt the veins. Some patients go home with the chemotherapy infusing over several days. This line can be used for those medications. If you have a PIC, please sure you wear a shirt that allows us to easily reach your upper arm in the bicep area. Having a tank top under a shirt works great for this. A port is inserted by a physician at the main hospital at interventional radiology. It does require some mild or light anesthesia. A port is placed under the skin. So after the incision is healed, it's okay to get wet. So it's a good choice if treatment is a lengthy or ongoing treatment. The tip of the catheter of the port is also in that very large vein with a lot of blood flow, so there's no problem with harsh medications. A port can stay in place for years, or it can be removed after your treatment is complete. Something important to know about a port is that they need to be rinsed or flushed every 6 weeks. So even when you are not getting treatment, if you still have the port, you will need to come in to see us for a port flush. It's a short visit that only takes about 30 minutes, which is just enough time for us to see how well you are doing and to get caught up on your life. Some patients go home with chemotherapy infusing over several days. This line can be used for those medications. When the port is accessed, it is covered with a sterile dressing and it cannot get wet. Accessing your port is a sterile procedure, and we have to be able to clean 4 inches around your port. The only way we can do that is if you have a button down shirt on so that we can move it out of the way. We will button it back up right after we get the dressing on the port. Nurses who are trained are the only people to access your port. medical assistants or phlebotomists do not access ports, but at Infusion Therapy, ports are our specialty. This is our check in and waiting area. Arrive at the clinic 15 minutes prior to your appointment time. We have two clerks to check you into your appointment, or you can use the automated kiosk to check yourself in. Please give us a call if you are running late. If you will be receiving your treatment in the infusion clinic, there is a checklist in your binder with some reminders. You do not have to write everything down, but let's review that checklist now. Eat a light meal before you come in. It really helps to have something in your stomach before receiving treatment. Drink plenty of fluids. When you are sufficiently hydrated, it's better for your kidneys to process the anti-cancer medications, and it's easier to start an IV. Bring medications and supplies that you might need. It is okay to bring your medications from home that you might need for pain management or for anxiety. Bring your patient guide and your personal organizer. And remember, if you have a port, wear your button down shirt. Check in at the main check in desk for infusion therapy. You can wait in the lobby or in the comfort center and library. Just give the front desk your cell number and tell them where you will be when you check in so that we can find you. A medical assistant will call you back. Your height and your weight will be recorded so the appropriate dose of medicine can be calculated. We take your weight every time. You'll also have your blood pressure, pulse, temperature, and respiration rate taken. We will ask you about pain and fatigue. We will ask you to review your medication list, and we always want to know about any changes in your medications, including herbs or natural supplements or over the counter medications that you are taking. You'll have your IV access established, either a peripheral IV or a port or a PIC specific to your needs. You may receive medicine before the treatment begins to minimize potential side effects like nausea or a hypersensitivity like reaction. Before your medicine is given to you, the oncology nurse will double check with a second nurse your name, the medicine name, and the dosage. It can take several hours or all day to finish the whole infusion process, depending on how many medications and how well you tolerate the infusion. When your session is done, the nurse will take the IV or the port needle out and make sure that your vital signs are stable. The nurse will again go over any side effects you might expect to have and how to manage them. You'll be told to call your doctor if you have any severe problems such as mouth sores, nausea that doesn't go away after treatment, or diarrhea or fever. There's a page in your binder that lists these important things to call the doctor for. You might have a long infusion time for treatment at the clinic. Our treatments can be 1 hour long or 8 hours long. If you have a long treatment, bring food to eat. We do offer snacks, water, tea, and coffee. However, strong odors can make some patients feel nauseous. Please be courteous to your fellow patients and don't bring strong smelling foods into the clinic. Also, please refrain from wearing any clothing that has any kind of cigarette odor or other smoking odors on it. Bring things to entertain yourself. Most importantly, please bring headphones suitable for your electronic device, either wireless or the kind that plug into your device. That way, other people around you don't have to listen to your movie, your music, or your personal phone call. You can also bring magazines, books, or laptops. We do have free Wi Fi. You can bring knitting or other handicrafts that don't require glue or paints with strong odors. Or you can just bring your noise canceling headphones, lie back with one of our warmed blankets, and take a nice long nap. For most patients, there is also the option of rolling with your infusion going out to the healing garden if you need a break from the clinic. Of course, safety is always our priority, so you will need to ask your nurse if being out in the garden is a good idea. It depends on the medications you are receiving and where you are in your treatment cycle. We are more likely to let you venture out there after we've seen how you respond to your medications. So don't count it on your first day of treatment. But after that, we would love for you to enjoy our healing garden. Our infusion center is taking care of a lot of people, and we are all sharing this space. At this time, only patients getting their first treatment and those who need assistance with mobility or translation may be accompanied by their designated care partner for their entire visit. With our current volumes and stall space, it's just not possible to accommodate unlimited visitation for everyone. But we know how important it is to have some company. Visitors can come in for an hour of your appointment. Please pick up one of these flyers at the main check in and give it to your visitor so that they are aware of how visitation works at Infusion Therapy. We all love children. Kids make us happy, but the infusion clinic is not a place to bring children. We are very happy to have young people under the age of 18 come for a brief visit to see where their adult is getting treatment, but they may not stay with the patient. If you have a person who is under the age of 18 with you at infusion, we require that another adult over the age of 18 be present and be responsible for the child. If the situation becomes at all disruptive, the child will need to leave. Very rarely, there might be a delay in your appointment. We do our very best to keep to this schedule, but it is very hard to predict how long it will take to be with a person who is coming in for their first visit, or who is experiencing an allergic reaction, or who is needing special attention because something has dramatically changed since their last visit. Come prepared with things to do during the wait, and remember that when we are with you, we will be giving you the same special attention that we are giving everyone else that might be causing a delay. Remember, we do have the library and the comfort center. It has a community puzzle and rocking chairs. You can wait there, or people can wait for you there to complete your treatment. What questions do you have? Write them down. Any questions about ports or other types of infusion or about what to bring to the infusion clinic? Do you need to get a button down shirt? Do you need to arrange for childcare during your appointment? Take a deep breath. You've taken in a lot of information, and most of it is probably new to you. It's okay to feel a little nervous about what's going to happen at your infusion appointment. You've taken a step in the right direction by making time for this important education. We've learned about intravenous infusions, types of IVs, how to check in for appointments, and things to bring or not to bring to the appointment. We hope you now have a better idea of what to expect at infusion therapy. We are all here to take care of you. It's not only our job to take care of you, but also our privilege, and it's what we love to do. It's what some of us in this picture have been doing for the past 25 years. And it's such an honor to walk with you on your journey. Thank you for choosing Enloe Health.